Hello guys, in this video let us discuss about the questions given on basics of liver. So coming to the first question, during liver resection at which of the following site clamp is applied to control bleed? Okay, so here we have given the 4 sites. This question is based on Pringle maneuver. Okay, let us discuss what is Pringle maneuver first. So application of the clamp over the hepatoduodenal ligament. So here we have the hepatoduodenal ligament. So application clamp over this place is called Pringle maneuver. So this hepatoduodenal ligament contains 3 important vital structures. Okay. The first structure is hepatic artery. Second important structure is portal vein, and third important structure is CBD, common bile duct. So while doing liver resections and other surgeries during the control of bleed during blunt abdomen injury also, we apply pressure over this hepatoduodenal ligament to control the bleed. This can be achieved by directly applying any hemostatic clamp or manually compressing this hepatoduodenal ligament or using these vascular clamps. Okay, coming to the options, site A is to occlude celiac trunk and portal vein. No, site A is fine, but celiac trunk is wrong option, so this is wrong option. Site B to occlude hepatic artery and portal vein. No, here in this picture site B is given at the celiac trunk, so this also wrong option. And coming to the option C, site A to occlude hepatic artery and portal vein. Yes, this is the correct option. So option D, site C to occlude right hepatic artery alone. No. So to control bleed we should occlude both portal vein and hepatic artery. So answer for this question will be option C. Coming to the second question, which of the following statement is true regarding functional unit of liver? So let us discuss something about functional unit of liver. Okay, the functional unit of liver is arranged in hexagonally arranged lobules with central vein in the center and portal triad in the each edge. Okay, this portal triad containing the branch of the hepatic artery and branch of the portal vein and the tributary of the bile duct. This both hepatic artery branch and portal vein will open into the liver sinusoids. These liver sinusoids are lined by the endothelial single layer endothelium. Okay, and let us come to the 3 important cells of liver parenchyma. So liver contains important cells of hepatocyte, and second important is Kupffer cells, and third important is stellate cells of Ito. Okay, let us discuss one by one. These hepatocytes are arranged in cords. Okay, hepatic cords. The apical surface of these hepatocytes is faced towards the bile duct, whereas the basolateral surface is exposed towards the sinusoids. Okay, and one more thing we have to discuss, the space between the hepatocytes and the sinusoidal endothelium is called space of Dissay. This is space of Dissay. This space of Dissay contains the stellate cell. This stellate cell, whenever they are inactive, in inactive stage they store vitamin A, whereas in active stage, when the stellate cell get activated by the chronic alcohol or any infection with the hepatitis viruses, they got activated and they secrete extracellular matrix and thereby causing the hepatic fibrosis. Okay, coming to the Kupffer cells, these Kupffer cells are present in the liver sinusoids. Okay, they are present in the liver sinusoids. They are very important to clear bacteria in the sinusoids and also to remove the old RBCs. Okay, this is also very important function of Kupffer cells. And one more types of cells which are present in liver is cholangiocytes. These cholangiocytes are lining endothelium of bile ducts. Okay, coming to zones of the liver, zones of the functional unit of the liver. Functional unit of the liver is divided into three important zones, starting from the periphery towards the central vein. The zone surrounding the portal triad is called zone 1. So this zone 1 is periportal zone. Okay, and second intermediate area is zone 2. Zone 2 is intermediate zone. Okay, and the third zone that is lying close to the central vein, that is pericentral zone. This pericentral zone is called zone 3. So these have each and every zone have specific features. Zone 1 receives highest oxygenated blood, so they are more resistant to hypoxia. Okay, and the second, one more important thing, cocaine toxicity is seen in this zone. Okay, and second thing is zone 2 or intermediate zone. One important factor you should remember, yellow fever affects this zone. And coming to the zone 3, this receives least oxygenated blood. Okay, least oxygenated blood, so they are more prone for hypoxic injury. Okay, and one more important thing about this, have highest concentration of cytochrome P450. So this is metabolically very active. As this metabolically very active, this is more prone for injury with alcohol. So alcoholic fibrosis is common in this pericentral zone. So coming to solving the question, zone 1 is more resistant to hypoxia. Yes, as this receive more oxygenated blood, this zone is more resistant to hypoxia. Zone 3 is more resistant to hypoxia. No, this is more vulnerable to hypoxic injury. So this is wrong option. So zone 3 is more resistant to toxic drug. No, as this area is more metabolically active, this is more vulnerable to toxic injury. Okay, and zone 2 has highest metabolism with cytochrome P450. No, we already discussed. Zone 3 has highest concentration of P450. So this is also a wrong option. The answer for this question will be option A. Coming to next question, that is third. A political leader is doing hunger strike for last 48 hours. Okay, liver provides energy substrates to survive further by which of the following mechanism except. So this question is based on role of liver in carbohydrate metabolism. Liver have the central role in carbohydrate metabolism, where it stores and supplies the glucose to peripheral tissue. Some tissues completely depends on glucose for their energy substrates. They are brain and erythrocytes. So liver provides energy substrates to these important vital tissues. Okay, in fed state, whenever there is excess glucose, this glucose is converted into glycogen. So glycogen is produced in both liver and muscle. But whenever the patient is in fasting state, liver only produce blood glucose. Liver only contributes for blood glucose. but whereas muscle cannot contribute for the blood glucose. Why? At the end step of glycogenolysis, glucose 6 phosphatase is there. So muscle does not contain glucose 6 phosphatase. Due to this reason, muscle cannot contribute for blood glucose. Okay, and whenever the patient goes into the fasting state, liver will shift towards the glycogenolysis, as we already discussed, and once the glycogen is completed, now the liver will shift towards the gluconeogenesis. Okay, whenever the patient is fasting for more than 48 hours, the glycogen stores will be completed. Now the liver will shift towards the gluconeogenesis. From where the substrates will come for this gluconeogenesis? Mainly two important things will contribute for the substitutes for the gluconeogenesis. Okay, one is muscle breakdown. Muscle breakdown will produce amino acids, mainly alanine, and lipid breakdown will produce the glycerol. These two things will help in gluconeogenesis. Okay, as the time of the fasting increases, now the liver will shift towards the ketogenesis. Okay, coming back to the question, liver produce energy substrates to survive further by which of the following mechanism except? So coming to the option A, gluconeogenesis. So gluconeogenesis is the correct thing, and second is glycolysis. No, this is wrong. So glycolysis is not going to happen in the liver in the fasting state. Next thing, ketogenesis. Yes, we already discussed in the prolonged fasting, the metabolism will shift towards the ketogenesis, and lipolysis already we discussed. Lipid breakdown will happen in the fasting state. So answer for this question will be glycolysis. Coming to the fourth question, which of the following are not used for calculating MBLD score? So this is concept is based on quantitative test for the liver function. So whenever the patient undergoing any liver surgery, or the patient is having pre-existing liver disease, he is going to undergo any general surgery procedure, the prognosis of the patient and prognosis of the surgery can be calculated by two important scores. So one among them is MBLD, model for end stage liver disease. Okay, this score is very important to calculate prognosis in the patient undergoing the liver transplant. So what are the factors we will used in this calculating this score? One is bilirubin level, which will help in the excretory function of the liver. Second one is PT-INR, which will help in assessing the secretory function, and third one is creatinine, which will help in assessing the kidney function, and the serum sodium level. Okay, these are the four important things we will use in the MBLD score. One more important thing score that will be used for the assessment of liver function is child pug score. Okay, here we use both laboratory test and clinical. So clinically we will assess for ascites and presence of encephalopathy. Okay, and lab we will use serum bilirubin, INR, albumin. Okay, we will see for this serum albumin, INR, and serum bilirubin. Okay, Coming to the question here, which are the following are not used for calculating MBLD score? So bilirubin we already discussed. We use albumin, no, we use this only in child-pug score. Creatinine we use, PTINR we use. So answer for this question will be albumin. Okay. Coming to the fifth question, in the following image, which of the following vessels favors to divide the liver segment into the right and anterior and right posterior segment? This question is based on the Coynard's classification. Okay, in this picture they have asked which of the following structure will help in dividing the right hemiliver into right anterior and right posterior. So let us have some discussion about the Coynard's classification. Historically, we used presence of external falciform ligament to divide right liver and left liver, but in the recent advancement we use Coynard's classification to divide the liver into right and left lobules, and thereby dividing them into 4 sectors and ultimately dividing into 8 segments. So in this division, these 3 incissuras will help us to divide liver into 8 segments. 3 scissuras divide liver into 4 sectors, thereby dividing them into 8 segments. Okay, the main scissura is the central one. So this is the main scissura which will divide the liver antero-posteriorly from the GB fossa to IVC. GB fossa to IVC, containing the middle hepatic vein. So contain the middle hepatic vein. This is the middle scissura and main scissura. So this is also called as Cantley's line. Okay, Cantley's line. One more scissura is right scissura. Right scissura containing the right hepatic vein. This will divide the right part of the liver into right anterior and right posterior. Okay, right anterior and right posterior. And the left side we have left scissura which will divide the liver into left medial and left lateral. Okay, the portal vein coming from below, this will transect the liver and this will divide the upper and lower part. So thereby the total division will help into divide the liver into 8 segments, and they are arranged in the clockwise. Okay, if you see, these segments are numbered in the clockwise. So let us talk about them. Thus, coming to the first segment, this segment is surrounding the IVC. The IVC lies ventral to this first segment, that is caudate lobe, and coming next will be in the left lateral part, will be divided into upper segment 2 and lower segment 3. Coming to left medial part, this is divided into 4A and 4B, and the next right half of the liver is divided into right anterior and right posterior. Right anterior contains segment 5 and segment 8. Right posterior contains segment 6 and segment 7. Okay, please remember, this is very important and repeatedly asking question. So we already discussed Cantley's line is extending antero-posteriorly from the GB fossa to IVC. This will divide the liver into right half of the liver and left half of the liver. So based on this, the surgical resections of liver are classified. So if you say the right hepatectomy include resection of segment 5, segment 8, segment 6 and segment 7. Okay, resection of left hepatectomy include removal of segments 2, 3, 4A and 4B. Okay, central hepatectomy. If you talk about central hepatectomy, it means removal of the liver segments lying close to the Cantley's line. So if you say central hepatectomy, removal of these 4A, 4B and 5 and 8 is called central hepatectomy. So this is the important table you should remember. Okay guys, this is the discussion. Please give your valuable comments or feedbacks in the comment section of our YouTube channel.